Hi everybody, welcome to podcast number 2. I'm here with Lesley Mitchell Clarke, and today we're going to be talking about hypnosis for the treatment of undiagnosed infertility. So Lesley, I happen to know, because I've also taken some training with Seth Deborah Roth, that hypnosis for infertility sometimes has higher success rates than fertility treatment.
Oh, I think that is true without question. I would probably put some other modalities in there, such as acupuncture, any kind of therapy that leads to relaxation and balancing. But I think the latest statistics point to alternative therapies, including hypnotherapy, have close to a 60% success rate, and that is at least 10 points higher than the sad 50% that is offered by the standard medical treatments.
Okay, so what type of clients are the type of clients that would come to see you for hypnosis for infertility?
Well, unfortunately, often in hypnosis, we are the last chance Texaco, as we say in the States. We are the last person to see a client because they have exhausted every medical avenue. So primarily the individuals that come to see me have been diagnosed with a real, sort of a vague thing where it's undiagnosed fertility for no particular reason that can be determined by the extent of the diagnostic tools that we have today. So generally people who come to me have been through a long siege. They are emotionally, physically, mentally, certainly romantically burned out.
Oh, too much trying.
Yeah, too much trying under structures and
time limits,
and they're generally coming to me with an incredibly high level of frustration and disappointment, and of course a huge question mark because their infertility rather has been undiagnosed, so there are no answers for them in the way that they want to accept them.
Okay, so when do people come to you as couples, or would they come individually?
Well, both actually, but frankly, I would be much more likely to see the female part of a partnership. And I think that's really due to the fact that if you just look at the nuts and bolts, if you will, the mechanics of procreation, men are simple. They're like Jeeps. They really are. The whole thing that goes on with them has to do with the quality and the quantity of sperm and the mobility of the sperm. Now, if all of that checks out, basically the medical professionals don't look at the man any further. However, women have a far more complex situation going. There's ovulation, the status of the eggs, if the eggs are viable. There can be possibly some endometriosis. There may be some other issues from perhaps a previous surgery with blocked fallopian tubes. So there's an array of issues that can affect women that may interfere with fertility.
Okay, and so how would you work with somebody who has may have these multiple factors going on?
Okay, well, the first thing that I do is I try to calm everybody down. That's the first thing that has to happen. And I learned this from my wonderful colleague, and she's now a teacher also, Sean Gallagher, who is a specialist in this type of issue. And, anxiety, as we all know as practitioners, anxiety and accelerated levels of stress impede everything. And particularly when you're talking about anxiety, you're talking about an aspect of the fight or flee mechanism, which is ancient. It's part of our most ancient engram. So women who are going through fertility treatments are stressed, of course, and so they are releasing chemicals into their system, cortisol, all kinds of hormones and chemicals which actually impede fertility. So it's a real catch-22. It's almost like the more involved you get in with the hormone therapy, possibly with invasive processes like test tube fertilization or egg harvesting, the more you get into all of that, the higher the anxiety levels are. And so the more likely you are to inhibit your own success.
Interesting. So what is some of the science behind the actual conception?
Well, I think we have been locked into a very simplistic idea about how conception works. And it was believed until only very recently that success with conception depended upon a high volume of sperm with a lot of mobility. So, and that the most aggressive sperm, the type A sperm, if you will, who could, approach the egg and break through the shell of the egg, that was how fertilization worked. Well, amazingly enough, the truth of the whole matter is that it's not a random event of like hordes of sperm running at the egg. In fact, and we only know this through incredible microscopic diagnostic tools, but the egg itself releases, now I hesitate to call it a sound. You could call it a sound if you wish, but it's certainly a vibration. The egg releases a vibration which we can document, we can chart it, and that vibration hooks up with a specific sperm. So fertilization of an egg, the beginning of a pregnancy, is not randomized. It has nothing to do with 10 billion sperm running at an egg. That egg knows what sperm it needs to fertilize and begin a new life. So one of the things that I do with this new knowledge in mind is, and particularly this is important this is a strong technique if someone is visual or kinesthetic or even auditory processor. I can have the woman turn up the volume on the vibration that her egg is sending out.
Isn't that amazing?
I can do that. And if I am working with the male part of the partnership, I can also have that sperm become more aware and hear the vibration that the egg is emitting.
That is fascinating. I do remember being taught in school, it's like the strongest sperm wins.
Yeah.
And they have little films of little sperms.
Yes.
Like, yeah.
What a male point of view, right? That volume is everything. In effect, it's we do increase our odds by having a volume of sperm, but that's just how nature sets things up.
Yeah, and as you were mentioning earlier, with all, if a couple is getting really stressed out and really regimented with their routine, and there's just no fun anymore, and all that cortisol is going through the system, it's probably causing a real imbalance in the pH as well.
Completely. And this is another aspect. I'm very glad you mentioned the pH balance, because something that was not fully understood is that women can actually be allergic to their husband's sperm.
You're kidding
Yes.
me.
Now, it's not overly common, but it's far more common than you may think. And it was discovered because there has always been a parade of women, going to the gynecologist complaining of symptoms that seem to be infection related, but in fact there would be no infection. And some very clever gynecologists finally figured out that these complaints occurred immediately after someone had had sexual relations with their husband. So it is completely possible to be allergic to your husband's sperm, or your partner's sperm rather, your partner's sperm, and that in effect is going to cancel ovulation, because everything in you, histamines are forming, everything in you is rejecting that material that you are sensitized to.
So what happens? Would you work with the woman so that she accepted the sperm?
Yes.
Or would they have? Okay.
Yes, that's exactly what I would do. I would work on the acceptance of the sperm, and there are even treatments for this rather rare type of allergy. There are medical treatments that can alleviate the symptomology of the allergic reaction. I think that they are steroidal in nature, so it's always, you have to proceed with caution, but certainly we would give the female partner suggestions of acceptance to the sperm, and then maybe even address the symptomology individually, the swelling, itching, burning, whatever it is, and key it all out.
Right.
Yeah.
And for a lot of people who don't already know, NLP has the allergy process protocol, which teaches a person whose immune system was once allergic to something to accept it. So it's the same idea that can be used with the
That is what I use. I
Wonderful.
would say I use an NLP generated allergy program
Right.
if I am dealing with this particular situation.
So what is it that you would want couples who are going through this issue to know? What's really important that they know?
What's important to know if there is hope. There is absolute hope. Unless you've been told something like, you have, all of your eggs are stale, or unless you've received some type of diagnosis where you would either have to get a donor egg or go to some more involved medical procedure, there is hope. And I have worked with many, many couples with undiagnosed infertility and just simply help them to get out of their own way, really. And, it's kind of a funny thing, but it's not uncommon for a couple who has experienced so-called infertility to go through adoption, right? They go through the adoption process, and once they do that and they have their adopted baby and they're comfortable, bang, they're pregnant.
They're relaxed.
Yeah, they're relaxed. They have let go, and there's an awful, I should probably add that there is an awful, huge sense of failure and responsibility that seems to primarily land in the lap of the women involved. And of course, the women are always the ones going through the most invasive procedures, whether it's daily estrogen shots, which makes you feel as if you're, in outer space, or an unending episode of PMS. These hormonal shots are horrific. If anyone has been through that, they will certainly understand. So there are a lot of emotional consequences, but the women come to me often with terrible feelings of despair, of being failures, of not being able to do the basic thing that they're supposed to be able to do. So again, Dee Dee, we would probably do some parts work in that regard, because we're dealing with the core identity. And we want to use plenty of techniques that will restore that woman's sense of self-worth.
Wonderful. Well, thank you very much. This has been very informative.
Thank you,
today.
Dee Dee. Thank you so much for allowing me to chat about this really intense and difficult problem.
Yes, thank you.
Okay.